So my name is Ryan Adessky, and I'm a fifth-year general surgery resident at University of Toronto, and I'm completing part of my chief year at Humber River Hospital. Surgical residency really is an apprenticeship, so we work closely with the attending surgeons, and the emphasis is really placed on on-the-job learning. So the days usually start with morning rounds, where we check in on patients who are recovering from surgery, and then spend the day in the operating room, where we participate and assist in surgery commensurate with our level of training. After hours, there's a resident on call 24/7 in-house to work with the staff surgeon to provide care for surgical emergencies. And I guess my last role as the chief general surgery resident is to help assign residents to the operations and clinical activities that best meet their educational needs, which really involves a lot of Excel spreadsheets, which is the part of becoming a surgeon that they don't really tell you about. Training here has been amazing. The educational environment is really exceptional. The surgeons here are constantly trying to upskill each other and seek each other's input. And that's really reflected also in the way trainees are taught. So multiple times a week we have video review sessions with Dr. Hagen, Dr. Klein, and several of the other attending surgeons where we review the previous day's operations to try and learn from each other and share tips that we've learned from operations that we've done. Besides that aspect, the breadth of clinical work here is really amazing, from a busy acute care surgical service to a really diverse range of elective surgical operations. The pride that the surgeons have in the work that they do here is also quite infectious. It's hard not to feel privileged to be part of this team and come into work every day. So residents are a really important part of the team in various places in the hospital, and we really do wear a number of hats, from teaching junior trainees and students, as well as participating and assisting in the operating room and being really frontline workers providing care for surgical emergencies. In addition to that, the investment that's placed in training residents hopefully will pay dividends in the decades to come as we take on leadership roles and provide care, and hopefully in the education that we provide to future generations of trainees. I just want to say thank you to all the physicians and nurses and other members of the staff who play a role in training residents. I love this place, and I hope they'll have me back.